Well, today I start with pre-medication and preoperative instruction. The pre-medication and preoperative instructions are following. Consent, nil per oral, that is 8 hours for solid, 6 hours for liquid, 2 hours for clear fluid like water, and non-pulpy juices like happy in the infants. 6 hours for formula feed and 4 hours for breast milk. Anti-anxiety medications, tablet alprazolam at bedtime and in the morning in only highly anxious patient, hypertensive patients with a history of arrhythmia, etc. Most of the time, reassurance and counseling the patient reduces the anxiety and drugs are not needed. In children, syrup, midazolam, clonidine or dexmedetomidine may be used. Anti-aspiration prophylaxis like H2 receptor blockers or proton pump inhibitors like at bedtime and in the morning in high-risk cases like obesity and intra-abdominal tumors. Other drugs like metoclopramide and antacids like sodium citrate can also be used. Others, anti-secretory medication like glycopyrrole in difficult airway cases where fiber optic intubation is planned. Nebulization with salbutamol for asthmatic patients. Patients with comorbid illness are on a variety of medications which undergo myriad interactions with anesthetic agents and can adversely affect the patient's outcome. It is imperative to acquaint with the pharmacology as well as their interactions with the anesthetic agents. Highlights the important medications and their timings with surgery. Investigations. What are the investigations to be sent? So this before surgery is sent and mandatory in all patients. It needs to be tailored to patient's needs as well as surgical factors. The investigations may include blood, complete blood count, serum electrolyte, kidney function test, liver electives, coagulation studies, ECG, chest X-ray. More advanced testing may be warranted in a specific group of patients. The investigations are done on an individual basis. Hemoglobin level estimation is important in anemic patients. Similarly, CBC, serum electrolytes, renal function test, and coagulation profile are valuable for patients afflicted with antihypertensive medications continue on the day of surgery except for ACE inhibitors or ARBs. Beta blockers, digoxin, continue. Thyroid medications continue. Opioids continue. Oral contraceptive pills continue. Eye drops you have to continue. Anticonvulsants continue. Asthma medications continue. Corticosteroids, oral or inhaled, continue. Statins continue. Corticosteroids continue. Aspirin continue in patients with prior percutaneous cardiac interventions, high-grade ischemic heart disease and significant CVD, that is the cerebrovascular disease, otherwise discontinue 3 days before surgery. P2Y12 inhibitors, that is the clopidogrel. No need to stop in patients undergoing cataract surgery. For other cases, clopidogrel has to be stopped 5 to 7 days before surgery. Insulin for all patients, discontinue all short-acting insulin on the day of surgery except insulin administered by continuous pump. Type 2 DM, none to half of long-acting or combination insulin on the day of surgery. Type 1 DM, 1/3 of the long-acting insulin on the day of surgery. Oral hypoglycemic agents discontinue on the day of surgery. Exception, SGLT2 inhibitors should be discontinued 24 hours before surgery. The drugs which do not cause or increase insulin level, as for example metformin, can be continued even on the day of surgery. Diuretics discontinue on the day of surgery except for the thiazides. Now, COX-2 inhibitors continue on the day of surgery unless the surgeon is concerned about bone healing. NSAIDs continue, has to be discontinued 48 hours before surgery. Warfarin discontinue 5 days before surgery. Antidepressant anxiolytics continue. MAO inhibitors continue but avoid pethidine and ephedrine during the perioperative period. Now, chronic kidney disease, here many drugs are to be discontinued if they have adverse effects. Fasting blood sugar is the most important diagnostic as well as monitoring parameter for diabetic patients. ECG is done when there is a history of chest pain or palpitation. Advanced investigations such as echocardiography and pulmonary function tests may also be done when needed. Now I end this session. The rest of the lesson will be given in the next session when I come tomorrow. Thank you.